India's clinics and hospitals are crowded again. People are once more queuing up to see a doctor about coughs, breathlessness, and fever. This small community clinic in Delhi is seeing between 30 to 40 patients with COVID-like symptoms every day. At present, the sample positivity rate in the city is hovering between 25 to 32%. Scientists point to a subvariant of the Omicron COVID variant called XBB 1.16 as the culprit behind the new spate of infections.
This is not a very severe variant. It's not causing the kind of infection in which the patient may face respiratory distress or needs intensive care with oxygen support. It's mostly mild.
Despite the number of rising cases, most public spaces are still seeing large crowds with no safety protocols being followed. The rising COVID infections have caught the attention of the authorities as well. The Delhi government says that it's on high alert to deal with the spurt in cases and that it is fully prepared to handle any kind of emergency. Dr. Sandeep Goyal, a public health expert, says that the latest variant is highly infectious and people should follow basic precautions and accept that the virus is here to stay.
The knowledge, although extensive, is again limited by the fact that mutations are very hard to predict. We go by the historical data, historical illnesses which we have seen for the past 100, 150 years, that data is available. It's likely to be less and less severe with time, and these spurts and these sublineages or some variants can keep on coming.
The country so far has seen 3 big waves of coronavirus. According to the government, in 2022, 90% of India's adult population had been fully vaccinated against COVID. But the numbers are still lagging when it comes to booster shots. Health experts warn that India cannot afford to let its guard down. The traumatic consequences of an unchecked pandemic are still fresh here.